All right, welcome back, everybody. So now we're going to pick up with our lecture talking about different kinds of cannabinoids, or yeah, cannabinoids. Oof, oh man, pronunciation is still hard. All right, so what are cannabinoids? They are a bunch of fat-soluble compounds that are found exclusively in cannabis. They all have fairly similar structures. As you can see, there are several types of cannabinoids. The main three that most people have heard about are THC, just shown right here, um, and then cannabinol and cannabidiol. There are actually way more, right? 85 plus, but these are the three that we mostly pay attention to. So THC, or delta 9 tetrahydrocannabinol, this is the main psychoactive cannabinoid in cannabis. And remember, when we say psychoactive, what we really mean is that it causes a behavioral effect. Cannabidiol, or CBD, is not considered psychoactive. That's basically why you can find CBD everywhere. You know, you can get CBD added to your smoothie. I was at Whole Foods yesterday. You can get all kinds of CBD products there. If you go to New York City, right? If you go to Manhattan, there are trucks that say like they sell weed products. They don't sell weed products. They sell CBD infused things. So it's not psychoactive, but it may be medically relevant. This may be medically relevant part is a big maybe. We have not really done much systematic research on CBD and whether or not it has a lot of the effects that people claim it does. So people claim anti-anxiety, antipsychotic, anti-inflammatory, anti-nausea, anticonvulsant. All of those have been attributed to CBD, but there hasn't been a lot of clinical trials to sort of test that out. Cannabinol, which we won't really talk about, is it's a degradation breakdown product of THC that comes in when you expose it to oxygen and light. This is why if you are a chronic cannabis user, you will know that cannabis should be stored in a dark place that is airtight. This is why, because if not, your THC will be converted to CBN, which is not psychoactive, or it has psychoactive activity, but not much. So your weed will lose a lot of its efficacy and potency. Right. So one of the ways that cannabinoids are used are pharmaceutically. So basically as medical use is what I mean here. So some are natural extracts, others are synthesized. The synthesized versions, which usually start with WIN, W-I-N, you'll see those more when we talk about cannabis research next class. The natural extracts are more what you see in different products that have THC and CBD. So one example is Sativex, right, which is a derivation of sativa, one of the strains of cannabis. It's a natural extract. It's supposed to treat the symptoms of multiple sclerosis and cancer-related pain. The multiple sclerosis component is mostly because of the anti-inflammatory effects of THC and CBD. That one of the main roles of cannabinoids and endocannabinoids is being an anti-inflammatory. And one of the theories behind multiple sclerosis is that your immune system is overactive and attacks myelin. And one of the ways to help with that is to reduce inflammation, which means basically reducing the response of your immune system. So some synthetic cannabinoids are more stable and they have higher potency. They're mostly used for research. Some may prove effective in treatments of diseases. Some examples of synthetics that are Schedule 3 and Schedule 2 are Marinol, which is also dronabinol. It is a synthetic THC, so it's a similar structure, but it's not extracted from a plant. So it's approved in the U.S. to treat anorexia, because basically increasing their appetite, and nausea and vomiting associated with chemotherapy in cancer patients. So something about THC helps reduce that vomiting reflex. Casmet, it's a similar thing to THC, and it treats the same stuff as Marinol. Okay, so there are a lot of different possible therapeutic effects of cannabis and cannabinoids. Here are some of the ones that we see. The decreased intraocular pressure is why it's prescribed for glaucoma. Decreased spasticity, ataxia, and muscle weakness. That's the multiple sclerosis, cerebral palsy, spinal injuries. I don't know a ton about we won't talk a lot about the mechanism behind this one. We will talk next time about analgesia, its ability to block pain, especially treatment of cancer pain and postoperative pain. These particular kinds of pain, all three of these are known to not be well treated by opioids. So CBD or cannabis or THC might be a good alternative to consider. Appetite stimulation is really important. It's one of the main medical uses of current medical uses of cannabis. So if you have trouble eating because you're experiencing cancer or AIDS and you're having trouble keeping anything down, appetite stimulation along with the antiemetic effect. Antiemetic means it stops you from vomiting. Those two effects combined can really help these people improve their quality of life and eat. Bronchodilation is an interesting one. Anything where you are inhaling something other than oxygen is really not going to be great for your lungs. Marijuana does expand your bronchi, and I had a friend in college who swore that smoking cured his asthma, but I would not consider that to be a legitimate claim. So I think I'm going to cut it short there. So we talked about different cannabinoids, their types, and their uses, especially medical uses. The next video will also be a little bit of a shorter one, and it's going to be about pharmacokinetics. So we'll talk about administration, metabolism, and tolerance mainly. So the tolerance can be pharmacodynamic or pharmacokinetic, but it just fits in well with this section. So we're going to address both kinds of both mechanisms of tolerance here.